Thank you for joining me and learning more about human trafficking. Today, we will discuss tips for evaluation and management in the ED. I often hear from people that they don't know how to approach cases of human trafficking. So my goal is that if you've already learned about human trafficking from other presentations, that this lecture gives you a framework to put all your knowledge into good use. And if you've never learned about human trafficking before, I want to give you a foundation to build your knowledge. And in doing so, we will explore some trauma-informed, patient-centered principles that are necessary for building good rapport in sensitive situations. The action means purpose model is an effective way to understand what human trafficking is. The purpose describes the types of exploitation occurring, often through commercial sex and labor services. The means is at the heart of the model, and it includes force, fraud, or coercion, which must be present for human trafficking to occur. As healthcare providers, we do not need to prove that this has actually occurred, but what we do need to be able to do is determine if someone may be forced, tricked, or coerced into exploitive and abusive situations. In these situations, we can offer resources and assistance. It is also important to note that inducing a minor into commercial sex act is considered human trafficking, regardless of the presence of force, fraud, or coercion. And this is likely a situation of a mandatory report. The action piece describes how individuals may be brought into and kept in situations of trafficking through recruitment, transporting, and obtaining individuals for the purpose of exploitation through commercial sex and labor work. Due to the hidden nature of human trafficking and the many concerns that may be found with reporting and obtaining data, establishing accurate data is very difficult. It has been estimated that 40 million people are victims of human trafficking worldwide, of which about 25% are children and about 70% are women. Nevertheless, we also acknowledge that boys and men are often less likely to disclose, and we may also be less likely to identify them as someone who is affected by human trafficking. It is important for us to understand the types of trafficking and the groups of people that we commonly think of being affected by trafficking. For many of us, we imagine a young female who is being sex trafficked. If this is the only image that we have, we will fail to miss boys, men, and labor trafficking. It's important for us to recognize that human trafficking cases can look very different from each other and can truly affect anyone. To get us started with our discussion on tips for providers, I wanted to share with you Russell's story, as I think there are a lot of key points that we can take away.
So my first trafficker was my mother, who started selling me to the landlord, and the landlord was part of a pedophile ring. This all became very normal for me. When I reported it to my mom and she did nothing about it, I realized that nobody was going to ever do anything about this. So by the time I was 9 years old, my behavior became so difficult and just outrageous for my mother to deal with, and for schools and just in general, the emotional trauma of what I had been going through manifested in really extreme behavior problems. And so I ended up in foster homes, eventually in group homes, because even foster homes weren't well equipped to deal with a child like me. In group home, I was abused there by some of the older boys, and one of them in particular started pimping me in the streets. So I've been pimp trafficked, familial trafficked, and then by the time I was 18 and I was on the streets on my own and had no pimp, I was survival sex and having to do whatever I could to survive in that space. So young men and boys and grown men who have experienced this, we shut down. We do not talk about this. And we will overcompensate and become overly male, overly aggressive, overly violent, and really not disconnect from our emotions. Later on, when I was being trafficked on the streets, there were times when I would come to the emergency room. I had broken ribs and I had been raped and by my trafficker because I didn't comply. I'm living on the streets. I'm dressed kind of dirty clothes. I obviously hadn't washed, and nobody asked, how did this happen to you? They just, saw me as one of those street kids, who is part of the problem of society. The difficulty for healthcare survivors is really challenging. And you can't even really rely on just one red flag. Plenty of perfectly normal, healthy kids may exhibit one red flag. It's multiple red flags that then begin to start to trigger, like, we need to look deeper into this. I think ultimately what I'd like to leave people with is that if you don't know to look for something, you're never going to see it. So if you're not looking for boys as potential victims of trafficking, you're never going to find a boy. He could be sitting right in front of you. You're never going to even think about him being a possible victim of trafficking.
I think that Russell mentioned a lot of really great points, more than we even have time to discuss. Nevertheless, I wanted to highlight 2 points. One being that it is not any one sign, but the story and the ability for us to follow up and evaluate our concerns. Secondly, I can certainly recognize from his story that I have seen children present to my emergency department for behavioral concerns and adults who suffered assaults just like Russell. It is a great reminder to keep human trafficking on our differential. Thus, tip number 1, put it on your differential. If you don't ever think about it, you will never see it. It's important for us to recognize that victims and survivors do seek healthcare during exploitation. In one study, up to 88% of survivors did seek care during their exploitation. While there is no one set list of chief complaints seen in human trafficking, there are concerning features on history and exam that may require further evaluation of psychosocial needs and ways to improve health. It is important for us to recognize that there may also be stigma associated with many of these diagnoses, and sensitive approach can be used. So when we think about concerning features of a history and exam that we may encounter, more specifically for sex trafficking, we think about STDs, STIs, especially in children and young adolescents. If there's a history of having these types of infections, if they engage in high-risk sexual encounters, perhaps pregnancy-related concerns, trauma to the genitals or the rectum. More specifically for labor trafficking, we think about when individuals don't have access to protective gear. So they may encounter pesticide and chemical exposures, or perhaps they're out in the elements and have heat and cold related illnesses. Certainly musculoskeletal injuries that occur during work, respiratory problems, burns, and other types of work-related injuries. Of course, there will often be some overlap for both sex and labor trafficking. You may see in their history assaults or repeated injuries that they've come to healthcare for. Perhaps they have branding or tattoos that you see. Mental health and substance use are often found in individuals who are being exploited through human trafficking, and substance use is often used as a way to control individuals. They may also not have the proper identification that normal people would carry with them. Perhaps they are telling you about long or unusual work hours. They may not have a good understanding or awareness of where they are or the date. And they may have someone who presents with them who seems to be controlling and trying to take over the encounter. It's also important to think about risk factors because these can be important for identification and prevention. If we identify these early, we could actually help someone and perhaps prevent them from becoming trafficked with the right resources. So some of the top vulnerabilities that we have seen in sex trafficking, and this comes from the Polaris Project 2020 report, we see that substance use concerns, runaway, homeless youth, unstable housing, mental health concern, recent migration and relocation were the top 5 vulnerabilities. As we talked about with other symptoms and signs that patients may present with, labor and sex often share a lot of the same vulnerabilities. So again, for labor, we see recent migration, we see unstable housing, substance use concerns, but we also see self-reported economic hardship, criminal record, and criminal history as some of the top 5 concerns of individuals who have been exploited through labor trafficking. Just like we often have an image of a survivor, many of us automatically think of traffickers as being male. It's important to remember that traffickers can be female or relatives. Because our patients who may be experiencing trafficking often know the person who is exploiting them, it is really important that we always provide privacy and use interpreters. So this is tip number 2. Remember to offer this privacy to all of our patients. When looking at sex trafficking and sex and labor combined in terms of who the recruiters were, 42% were brought into trafficking by a member of their own family. 39% were recruited via an intimate partner or a marriage proposal. For labor trafficking recruitment, we see that the vast majority do tend to be potential or current employers, almost 70%. Nevertheless, almost 20% are still brought into a situation by someone they know. 15% were recruited by members of their own family, and 5% by that intimate partner. So again, people often ask, what am I supposed to do when I suspect a case of human trafficking? One way I developed was to think about it in terms of the 5 C's. First, we need to care for all medical needs. And as we are caring for all medical needs, we need to consider red flags and risk factors in their history and exams, just like we do with all encounters in the emergency department. When we notice concerning history and exam, in a trauma-informed approach and when appropriate, communicating our concerns with the patient about their safety, well-being is needed. You may also need to communicate your concerns with hospital staff to make sure that you are ensuring security for everyone who is around. And then 4, if the patient wants resources, try to connect them to resources as they need. This may look very different for different patients because everyone's needs may be slightly different. And then 5, you may also help patients find ways to make their situation safer. We can't promise we can keep them safe at all times, but we can discuss ways to help them be safer and create safety plans in this way. When I think about working through this encounter, I also like to think about the tools that I have in my toolbox. So that is 1, using trauma-informed care. We'll talk about the PAIR tool that can help us through that encounter. Thinking about screening questions that may be useful, grounding techniques that can help patients who are suffering from anxiety and stress in our emergency department, and then also using hypothetical or teaching about how common abuse and exploitation is in our community to discuss resources. So when I think about trauma-informed care, I really think about it's important to meet patients where they are at during the encounter, and to frame our thinking into trying to understand what has happened to the patient, to also understand the reactions and behaviors that the patients may be displaying. In order to do this, the patient needs to be medically stable to engage in a discussion. We need to make sure that we are meeting the patient's basic needs, offering them blankets, water, food, making them comfortable, ensuring that there is privacy, and then treating their symptoms, nausea and anxiety, so that we can build rapport and have a good discussion with our patients. Going back to that trauma-informed tool, the PAIR tool. This is just a way to help us remember how to work through a scenario. We've already talked about providing privacy. That was tip number 2, how important it is for us to use interpreters, and also explaining the limits of confidentiality without discouraging disclosure. E is really important for us to help normalize that abuse and exploitation is common in our community, and we're not just targeting them by asking these questions. And then A, asking them, is there anything you'd like to share with me? Would you like to speak to a social worker? Or letting them know that you've noticed something that is concerning, and asking perhaps, would you like to discuss resources or discuss in more detail with me or somebody else? And then importantly, remembering to respect and respond. If the patient doesn't want to disclose a situation or states that it's not occurring to them, respect their wishes. If they do, however, want resources, make sure you respond appropriately by trying to get the resources that they need. Oftentimes, I think it's important for us to have some language and how to ask questions related to human trafficking. This is the RAF tool. It is an adult screening tool that can be used to screen for human trafficking. And, question 1 starts off with, have you ever worked or done other things in a place that made you feel scared or unsafe? Have you ever been tricked or forced into doing any kind of work that you did not want to do? Have you ever been afraid to leave or quit a work situation due to fear of violence or threats of harm to yourself or your family? And 4, have you ever received anything in exchange for sex? For example, a place to stay, gifts, or food. This can be a really great tool to use in the emergency department with just 4 questions. I mentioned that oftentimes our patients may be experiencing kind of increased stress. So a grounding technique can be very helpful. And the purpose of the grounding technique is to allow a person to step away from the negative thoughts or flashbacks. Techniques such as these can decrease the intensity of a person's feeling and help them calm by using the 5 senses they have. Have them take a couple slow, deep breaths and get comfortable prior to starting. You can ask them kind of to use their senses in any order that you want, but one of the easiest ways is to start with 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. You can also adapt this to, what would you want to be able to hear or smell or taste? The idea is just to get them thinking about things in detail, to take their mind away from that intensity that they may be feeling at the moment in their current situation. My other tip kind of gets back to the education part and the PAIR tool. We know that abuse and exploitation occurs in our communities. And so one way that we can have a further discussion with patients is when we are concerned that something is going on and they have not disclosed that situation, we can ask them, and say, hey, we know that abuse and exploitation is really common in communities. Would you think this information would be helpful for anybody else that you know? Or we know that people's situations change. Would you want to learn about this information in case your situation changed? Oftentimes, people will talk through a really good safety plan and accept resources without actually disclosing that it's happening to them currently. Tip 5. I know that this should be common sense, but it's actually often missed. We sometimes are already thinking about our next questions and we fail to acknowledge others' responses. So when somebody does disclose, do remember to respond with empathy and acknowledge that disclosure. Try not to panic and move on to your next questions. And don't just leave right away to get another staff. Make sure you ask, is it okay if I bring social work into this conversation? And it can all it takes sometimes is simply saying, I'm sorry that this has happened to you. Tip number 6. If you have a case of suspected sexual assault, making sure that it's human trafficking, make sure to keep human trafficking on your differential. Oftentimes, it can be difficult to know if this was truly a sexual assault, and depending on where you live, there may be various clauses about caregiver status and ages, and so it can become a little bit different in terms of the mandatory reports state to state. So always make sure you refer back to your own state's guidelines on mandatory reporting. With that being said, most states have specific laws on sex trafficking in minors. Minors cannot engage in any form of commercial sex acts or survival sex. Now, many states do not have specific labor trafficking laws in minors or dependent adults, nor do they have specific sex trafficking laws in dependent adults. Again, with that being said, if you encounter a minor who is in a labor trafficking situation or a dependent adult who is also in a human trafficking situation, it may fit under some other definition of child or dependent adult abuse. So again, refer back to your own state's laws in regards to these manners. So tip 7, we know that social work is not always available, and so knowing your own local resources is really important. There is certainly the national hotline that is available, and it is a confidential 24/7 toll-free hotline number. They also have a text number. There are interpreters available with this service as well. Many states also have a statewide crisis line, or perhaps you even have local crisis lines and advocates available. Knowing what your shelter options are, food banks, free medical clinics, any type of legal services which may be available, or are there culturally specific services available in your area? Tip number 8, considerations for documents. for documentation. We know that patients have always had access to their medical records, but with the Cures Act, patients now have immediate access. And we also know that patients are utilizing their patient portal systems more and more, so they are reading our notes. And not only that, so are the people who have access to it. So if somebody presents to the emergency department and through their patient portal system, they start getting lab results that come back, this shows to the patient and whoever else has access to the medical record that the patient is likely in the hospital accessing healthcare. So one of the things we have to think about is the challenges of balancing continuity of care, documentation requirements, and then possible, legal support and patient safety all wrapped into one. While many electronic medical records share similar features, it's important to understand the unique limitations and safeguards within your own electronic medical record. How do you mark notes sensitive, and what does that mean? Who can see it when the note is marked sensitive? And can you unshare a note with a patient? And what are your policies on documentation, in particular for sensitive information? As providers, we cannot guarantee the absolute privacy and confidentiality of information, but it is important to discuss ways that we can use our electronic medical records to utilize any safety measures that we have, and also discussing with our patients any limitations that may be present. Transparency with our patients is vital to building trust between patient and provider and the hospital system. So tip 9 is discuss documentation with your patient. One kind of phrase that I like to use that came from documenting ICD-10 codes and other sensitive information in the electronic health record report is a statement that goes like this. We've talked about a lot of important things that can affect your health now and in the future. Is there anything we've discussed that you do not want documented in your health record, or perhaps that you do? You can then go on to have discussions about MyChart, which is our patient portal system. What are the risks and benefits of it? Do you want to actually have this service? Are you worried that someone else might have access to your medical record? And what can we do to make your information more private? Do you want me to share, or do you want me to unshare the note so it doesn't go into your patient portal system? Should I flag my note as sensitive so other providers know unless they need to be in there, stay out? And then what is okay to print off on the discharge summary? Are you okay with these diagnoses printing off on the discharge summary? How can I call and leave a message or contact you with further information? All of this can be really helpful to discuss with our patients. And then tip 10, if you don't already have a hospital protocol, consider building one. And this also helps to strengthen community relationships when you do this. HEAL's Protocol Toolkit is a very valuable resource that can give you step-by-step ways to implement a hospital protocol and strengthen your community relations. So to wrap this all up, let's finish with a case example. In this case, we have a 40-year-old who presents with facial injuries. Patient is French speaking and arrived to the United States about 6 months ago. The injury did happen at work, and the patient is pretty vague in the details about how it happened. The employer presents with the patient, and then also several other family members who you're not quite sure who they are also show up. The employer is requesting to translate for the patient and heavily involved in the discussions. When registration comes, they let you know that they are concerned because they've had some human trafficking education that the patient has no insurance and did not bring an ID, and noted that the patient gave several different ages while during registration. So how do we proceed? I think about it when we're looking at it, there are lots of red flags and risk factors that are showing up. Most certainly, we're going to care for medical needs first. And as we're doing that, right, we're noticing these red flags. So there is, recent migration, immigration, unknown kind of documentation. Does perhaps the employer have control over these? The patient doesn't speak the local language. The employer is trying to speak and translate for the patient. And then we have this kind of unexplained injury that's really vague, and the patient is vulnerable because the patient has no insurance or identification. So tip 1, remember, put it on your differential. And tip 2, this is a case where you would really want to use interpreters and ensure that there is privacy. We know it can be so easy to use the person who presents with them as an interpreter, but we need to make sure that we're offering this privacy. And then tip 3, just remember to kind of work through this framework. And tip 4, think about your trauma-informed care principles. And so 2 things that can help you through that trauma-informed principle and also thinking about ways to screen for your patient. We have the PAIR tool and then the RAFT tool, the screening questions. So continuing on. So with all this going on, you communicate your concerns to the patient about their situation. The patient lets you know that they feel very safe in their situation as it is. So making sure with tip 5 that we respond appropriately to answering the patient's questions and then also the patient screening no to concerns for human trafficking. You can let the patient know that, hey, I appreciate that you feel safe now. And we understand that people's situations can change. Would you like to hear about available resources in case this happens to you or someone that you know? This opens up the door for the patient to have not disclosed, but still allow for time for a discussion about available resources. And the patient does state, yes, I would actually like to know more about these. You discuss resources in the local area, give the National Human Trafficking Hotline number, and the patient thanks you for the information. You also remember to make sure that the patient has follow-up and discuss with the patient about whether or not they would like to set up a patient portal system to look at the results and kind of their medical record. And the patient states, what are the risks and benefits of this? So you have a discussion, and at this time the patient declines and says that the best way would to be contact him through this number. So that kind of wraps up all those tips that we just went through. So do we know if this was a case of human trafficking? The patient did not disclose that it was. There were certainly risk factors present. You were able to do a good discussion about local resources and create a safety plan for follow-up. So while we can't say for certain that this is a case of human trafficking, our goal was not to have a disclosure, but instead to achieve good care and coordination with what we did. So these are some of the resources here that we used for this presentation. And I thank you very much for learning more about human trafficking with us today. Thank you again for your time.